Welcome everybody. This is Doug McCall from the International School Health Network. I'm pleased to welcome you to this session on health and life skills education, a part of a broad holistic education. I'm pleased to welcome Dan Leitch, Associate Professor at Simon Fraser University, Co-Chair of the FRESH Working Group, and also of the International Research Network that is going to be talked about today. I'm going to briefly introduce the topic, and then Dan and I will be taking turns with different slides as we move forward. Want to also emphasize that this is part of a series of 5 webinars that are preceding the Comparative Education Conference occurring later this month in Miami. And this is number 2 of that 5, and we're pleased to be able to offer the panelists, we have a panel on one of those days at the conference, the panelists a chance to expand and to elaborate on their remarks. And so I'm pleased to start the session, and Dan, if you wanted to start us up, and then we'll proceed through the slides. And Dan, I did learn that Mac computers do not work with the advancing the slides, so I'll do the advancing of the slides as at your command.
Okay. Yeah, we've been wrestling with that for a little while. Hello, everyone, and thanks for joining us today. I'll kick off the session here by introducing what we hope to accomplish today and the purpose of the presentation. So we have 3 things that we're hoping to accomplish. First is to, as painful as it is, describe the low status of health, personal, and social development education, and the way that countries and areas, institutions are approaching it. Talk about what the FRESH partnership has been doing to try to raise the profile of HPSD and see it as a core component of a comprehensive multi-component approach to promoting health development and education. And then invite participants here to join in a web-based discussion being led by the FRESH Working Group, the International Research Network, which you hear more about, and the Consortium of Education and Other Faculties, and our project also on social inclusion strategies to prevent violent extremism. So those are the 3 purposes we have for today. And when we think about doing this work, obviously the first thing you want to do is take a scan of where we are, and really where we are is that a lot of the best practice and what the research tells us we should be doing isn't being done. If you talk to any particular educator or activist in education, you really find that the approach where it is very programmatic in nature. That most of the work, the program development, the funding, tends to be issue or topic focused. It's not comprehensive in nature. That we know very little about the status, duration, or time that is spent in schools working on health issues. And from a research perspective, we don't really have a good sense of what it is we want to accomplish at a minimum, much less what we really would like to do in the ideal. Much of the curriculum that has been provided in the past that looks at scope and sequence for student learning, again, has been replaced by much more topic-specific programs and material. Any of that core curricula tends to get reduced or combined with PE or career education, and other kinds of more established curricular houses in the schools. Our initial teacher education programs may talk about the importance of a comprehensive approach in health, but again, even then it tends to be focused either on an issue-based program or embedded in instruction in PE or again those other kinds of curricular houses, and so it becomes something that's done off the side of one's desk or off the side of a curriculum. So at the end of the day, it really is that HPSD is the poor cousin to much of the rest of the education establishment, which makes it very hard for us to think about how we accomplish many of the goals and priorities that have been identified internationally. So there's 4 efforts really that we're engaged in to try to raise the profile of HPSD and support much of the work in this area. And some of these I'm sure you're familiar with. The FRESH Working Group is a group of international experts at the organizational level, and is working on a comprehensive report that will that will produce recommendations for what we need to do as far as measuring, monitoring, and improving HPSD through these types of web meetings, but also in a final report that will be issued in the fall of 2020. We have an international research network that's embedded in the World Education Research Association that is trying to look at the research agenda for HPSD. We'll be meeting in Spain this summer, and all things working out appropriately, bringing together a number of researchers globally to talk about the research agenda. We've established a consortium of education and other faculties, which is led by the Global Network of Deans of Education and the International School Health Network, to map out a long-term workforce development approach to this. And the Global Network of Deans of Education really came into being to help advance and make sure that academics are part of the conversation around policy that affects education. And in this case, we felt it was really important to make sure we include the broader university, because much of the work in health is done elsewhere. So wanted to make sure we have a very broad coalition working on that. And then finally, we're working through Public Safety Canada on a project to focus on how a broad approach to social development and health can work to build resiliency and prevent violent extremism in schools and communities by ensuring that by avoiding the idea of intervention on a programmatic basis or from a deficit model. So part of the work that we're doing, obviously, we want to respect the context in which much of this is, much of the research and much of the interventions are being developed. And so we looked at 3 different levels. We're looking at low resource countries, high resource countries, and countries at risk of violence and other challenges. So when we look at the example of what's going on in low resource countries, you can see why so often what tends to happen is we have all these programs in place to try to address specific issues. But when you start adding up all of the programs that need to be in place, it really illustrates the point that we need to do this much more broadly, that we can't possibly plug in a program for every need that exists. So just a very quick scan of what the research tells us around, based on prevalence reviews and other databases. You see that access to schooling, especially for girls, is an issue. Clean water, diarrhea, cholera, soil-transmitted helminths, pneumonia, malaria, eye, oral, dental health, physical activity, immunization. You can see there's a very broad list of needs in low-resource countries. Similarly, you can develop a list like that for high-resource countries. And you may see that there's some overlap, but there's also some substantial differences when you get into different contexts. But again, here you see the list of things that show up in high-resource countries: youth development, general health, genetic attributes, physical health and diseases, antisocial behaviors, mental health, life, personal planning. I won't read it all to you, but again, it becomes very apparent very quickly that a programmatic approach is really not going to be very successful at looking at the broad health of the community. So different contexts, different curricula, different programs, the Fresh Working Group. Again, examining what's available and what's being done in these three contexts: the high resource, low resource, and conflict disaster affected countries. We're looking at both the formal curriculum instruction, but also extended educational opportunities. So not just what happens in the class or in the schools, but what happens between classes and before and after schools, to really think about a much more holistic approach. Looking at different learning outputs that can be achieved, including basic fundamental knowledge, but also beliefs, attitudes, behavioral interventions, and all of these things that aren't the sole responsibility of schools, that also include parents, communities, media, faith-based organizations, etc. So the working group is looking at the different curriculum and program structures to see what we have as far as a core curriculum or program structure that fits or bridges across PE, career education, moral religious education, environmental science, home ec, all the different places where it tends to be housed now. Look at core co-curricular school routines and activities that are a focus. And here we mean things like hand washing, active recess, school meal plans, access to nurses, the engagement of community organizations, what regular use of extracurricular or non-formal learning activities are around, and then finally how HPSD can really be delivered in other core subjects and in a cross-curricular competency-based curricula that's emerging in a number of different places. And I'm going to turn it back to Doug. He is the master and the inventor of this slide, and he explains it best. It really shows the complexity of the work ahead of us, and so I'll turn it back to Doug here.
Thanks, Dan. And just briefly, I think the picture, although it's very crowded, is self-explanatory. We have the students at the center, and in the inner circle there, we have a number of core subjects that are often the way curricula are structured. The colored chunks around that circle are the UN goals, which are also indicative of the real world in terms of dealing with poverty or hunger or health or gender, and so it's a good framework for looking at the whole child. And then on the outside is really the number of different kinds of what some researchers are now calling extended educational opportunities. So you have co-curricular activities, you have working on school climate, you have extracurricular activities, you have school routines, and a variety of cooperation with the community, cooperation with the parents, and so that's the broad scope. And we did a scoping paper. When the slides are up and with the recording of this session, you'll be able to click on that link at the bottom of the slide, and you'll be able to be taken into a paper that describes that very broad scope. I guess for us the thing that might be quite different from any discussion that at least I've been engaged in about health and personal social development education is we're trying to start with the real world, or what the systems folks will call the organizational capacity. And so we tried to estimate how much time is actually available in the formal curriculum or in the school day or outside of the school day for learning about health and personal and social development. And not to our surprise, unfortunately, we found that only one country has any data on that, how much time is actually delivered in the classroom, and that's the Americans. The United States has an ongoing policy and program survey that they do. It's been diminished as their budgets have diminished, but they do have some data looking at how many hours of instructional time in health and personal and social development education is actually delivered based on teachers' responses. And we ended up having to guess for high resource countries, it's somewhere between 25 and 50 hours of instructional time. And we're really guessing at the number of co-curricular or routine-based learning and how much hours of extracurricular time is available too. And similar for the other context, we have very little data. We know that obviously in conflict-affected countries where they're really scrambling to find a place to gather students, let alone help them learn, we have no sense of what kind of formal instruction in health and personal and social development is available, or how many hours of routine-based learning could occur. So that's kind of what we're looking at. We had a session on this, and the expert who led that session really feels strongly that if you're going to deal with a topic, one of those many topics shown on those slides earlier, you really need over the course of a year to have 4 or 5 hours of in-depth instruction about that issue to make an impact, at least to get students to the threshold of being able to plan healthier behaviors or safer behaviors in their futures. And so that really gives us kind of a working estimate of what kind of capacity is available. And then we did a quick scan of about 20 countries, just their curriculum documents, and we found that about half of them, but they're primarily high-resource countries, have actually defined the minimum hours of classroom instruction. And there are a wide range of policy and guidance documents available. So one of our plans is to be able to look at those documents and at least to see what the intended curriculum is. But we'll have to find other ways of actually determining how much is being delivered, which is a real challenge. Here's a sample of what we found in that survey of 20 different ministry websites, and we looked broader than what the traditional view of health and life skills is, because we were also trying to capture social inclusion kinds of issues and the personal and social development aspects of our HBSD. And so we looked broadly. And so if you look at this column, and this is the province in Manitoba in Canada, you have that first column where you have we need some data about the context of the country. We found a number of related policy and other documents that relate to health and personal and social development. Going to the third column, we looked at cross-curricular documents, and we found documents like graduation requirements, or a document on integration within the curriculum, or there was a Manitoba document for foundation skills, and so on. The fourth column over is our primary focus. We looked for curriculum documents in health and physical education and in home economics, and so you can see what Manitoba has available there. They have combined their health and phys ed in their curriculum structure for the most part, but they also have a home ec middle years curriculum as well. And then social studies, we looked at that because of the implications for social inclusion and concepts like global citizenship and human rights. And so that's the finding there for there and so on. You can see the number of documents. And so that gives us a sense, at least in a high resource setting, what could be available through our intensive searching. And it's interesting, when we were in the presentation earlier this week, Esther Cole from Brookings Institution, they did a similar kind of analysis of curriculum documents, looking at it from a 21st century skills perspective, which is 21st century skills is kind of I'm really going to characterize it as a vocational orientation to life skills. And so they did the same kind of methodology to at least get a start as to what they were looking for they had a sample, I think, of about 40 countries. And so that's where we're going to be looking at, and that will be done through a content analysis of curriculum and policy documents as depicted in that Manitoba example. Another aspect of our work is, and this was in the title of the working group, Health Literacy, Life Skills, and Social Inclusion is the title. And so we have identified a number of behavioral theories as well as a number of what were called learning behavioral models. And so you can, if you look through all that listed, again, it's an extensive list, but we have health literacy, obviously, digital and media literacy, critical thinking. In the area of life skills, we have social emotional learning, critical thinking, decision making, concepts like positive youth development. There's a variety. Each of those titles has a body of knowledge associated with it, and some kind of following in the knowledge development network, knowledge development world for that kind of concept. And again, social inclusion, peace education, global citizenship, and so on, disaster risk reduction. It shows again the number of, even when you take it up a level to different behavioral models or learning models, it's still very, very crowded. And so one of the challenges for countries will need to be able to decide which of these models or theories that they're going to use to guide their work. And so that's kind of, again, will be a work that we're going to be doing as we move forward. A session earlier this week, we looked at some behavior theories, and here are the several behavior theories that we think are relevant to health and personal social development education. You've probably seen many of these in your own work, and each of them, I think, if you look at the very brief description for each of those behavioral theories, all of them are relevant. It's a question of which ones that we choose to use that we find more powerful or useful to help guide us and assess our work. In the discussion in an earlier workshop, we looked at two of those concepts, self-determination theory and moral disengagement. And Dan, if you could take us a little bit through the implications and the applications of self-determination theory to this notion of what we often call communities of practice. And I think as Dan goes through this, I think we're going to find that I've always said that a good theory, there's nothing more practical than a good theory. And so I think Dan's analysis here will be very helpful to show that is true. Dan?
Yeah, thanks. And what you're going to get here is about a 3 or 4 minute summary of about a 45-minute presentation. So hopefully I'll get it to make sense. But if you're not familiar with self-determination theory, it's really a global theory of personal wellness. And it looks at what situations or what experiences we have that how they support our individual sense of wellness. And the way it's organized and what it finds is that there are really 3 areas that are necessary for us to experience wellness, and that when any of these 3, what they call basic psychological needs, is thwarted, we experience unwellness. And so the 3 basic psychological needs are autonomy, competence, and relatedness. Autonomy is basically a sense of personal control, personal agency, being able to act of your own volition within the context that you're working, so a sense of empowerment. Competence is obviously a feeling that what you are doing well, you are able to do well, and you're able to engage in authentically. And then relatedness recognizes the fact that your actions occur within a community, and that your relationships with other people are important for your wellness, and that within your relationships, having a sense of autonomy and competence is also critically important. The really neat thing to me about self-determination theory is that it is an empirically based theory. So I won't go into all the details now, but there are what they call mini theories that actually are empirically verified and used to illustrate how you activate these or how you fulfill these 3 basic psychological needs. Obviously, if autonomy is an important aspect of this, really what you're talking about is motivation. And so much of the theory focuses on whether we are being intrinsically motivated so that the motivation to act comes from within us, or whether we are operating in a primarily extrinsic environment where we are being controlled by something else, and that something else can be a government or an organization or an individual, a manager, or even society in general, or a culture can be something that presents particular restrictions or guides our actions. And what SDT looks at is how those extrinsic structures in which we exist actually can be conceptualized as a set of values that over time and through engagement we begin to internalize. And so, and this is going to be somewhat value neutral because it really is a process of understanding where we are, incorporating the values of that context until they actually become our own. And once they become our own, then we find that our actions are quite autonomous because we truly define ourselves and value ourselves within that broader context. So it presents a map for us to go from one particular place to another particular positive outcome. So what I've done is tried to apply this theory to the idea of communities of practice. And one of the things that I noticed here in Canada was a few years ago, communities of practice or learning communities were all the rage among school districts. And the research is pretty powerful on communities of practice and or learning communities, and it talks about how groups will come together within a particular context to figure out how to act and how to work within that context. If you go way back to Wenger, who did a lot of the initial work in this area, it identifies that these communities will develop without any kind of nurturing or support as people work together to try to figure out how best to manage the context in which they are. One of the goals then, if you're trying to do this intentionally, is to figure out how do you support and facilitate the development of these communities in a positive way, so that they are working to advance the goals of the institution or the organization, because really they can work to advance the organization or thwart the organization. So you can have teachers who come together to advance the learning of the students in their school, or the teachers that come together to close their doors and work individually. It really is the community that creates those values within the school. So communities of practice was really exciting as people were moving toward how do we help these communities develop. And what we ended up finding was that there was a lot of control in how these communities were trying to develop. And so eventually, because of that control system, they kind of fizzled and faded away. And to give you an example, when we think about communities of practice, and autonomy of professionals, they can come in a way that is used to strengthen professional judgment and practice through application of research or data to inform the action in particular areas of practice, say student evaluation. You can bring the community together, you can support it in accessing research to solve problems that they're facing. What was happening, though, was the school districts was saying, you know what, we're going to have a community practice, and it's going to be on how to implement, for example, a no zeros policy. So when it's phrased in that way, you see how the communities of practice idea is being used to control teacher practice, that the research and data and information that we have available to us is being directed to the teachers to control their practice. And so there's going to be a lot less interest in uptake, and in fact there may be even active resistance to this because it is something that is being used to control teacher practice and limit their autonomy rather than strengthen it. When we think about how this can play out in the competence context, again, communities of practice can be authentically supported to empower teachers by supporting their skill development through professional learning regarding their own self-identified needs. So I may identify that I really want to focus on student evaluation and strengthening how I better understanding how I evaluate students, or I might choose something else. But the important part is that, I am choosing to direct my professional learning around what I see my students needing. Or in the case of what happened in BC, you see it being used to control skill development through targeted workshops. So we're going to have, for example, workshops on learning portfolios. It doesn't take into account whether I think learning portfolios are necessary or not, but this is what is going to happen to me. And then finally, you can see how it would play out in relatedness, in that it would strengthen community by helping teachers work together to address learning needs that they as a community have identified. So the context of my school may be very different than the context of your school, and we've come together in my school to identify the student learning needs or the student health needs or whatever it happens to be in my context. Or we use it to control teacher communities by directing change in response to a district-wide mandate or a provincial mandate. For example, where we may be required to implement a particular district reading program or some other kind of program. And so when you think about it from a self-determination theory perspective, as much as possible, you want to create the infrastructure that is there to support the autonomy, the competence, and the relatedness of the community, and let the community then, through the process of coming together and working to improve their context, figure out what it is that needs to be done and how to do it. If you support them in doing that, you're likely to come up with a very successful community practice. Whereas if you step back and figure out that you can mandate particular actions and behaviors, you may get them to actually do some of that work, but it's going to be very hard for them to actually see the value in that work and internalize it. And that's where you get a lot of the unintended consequences of many of the policies that we foist on educational communities. So sorry for taking so much time, and I know that it may not be as clear to you as it is to me based on the explication of the many theories, but that's how self-determination, I see self-determination playing out in education policy and how it might be applied in some practice. I'll turn it back to Doug because he's going to talk a little bit about moral disengagement. Hopefully Doug is talking. I can't hear anything.
Sorry, I got to click on my mic. Sorry, just before to make the transition to this slide, the use of that learning about professional learning communities I'd like to come back to, because a lot of what we do in health and life skills education is really giving prescriptive behaviors to students rather than enabling them to address the challenges in their life, or in telling teachers what and how to teach. And so it's a really a behaviorist kind of approach from the traditional medical model. And so we need to think carefully about the powerful lessons that we can learn from self-determination theory. And Dan's just highlighted one application for us. Moral disengagement, this is a theory we've encountered in our work on preventing violent extremism. And when I began to read about it, and that red font up above the page is really powerful. It's work done originally by Albert Bandura, and it just really is powerful if you're trying to understand why people not only why people develop extremist views or go to the highest level of extreme violence, but also in terms of violence and bullying and even petty violences and even what the research calls incivility in classrooms. It's the theory really helps to bring those kinds of things in a much clearer focus. Again, I'm not going to go on to we did a session on that. It's on the recordings that we can look back to, and there will be a concept note on this. But in health education, the idea of being concerned about the health of others is often in the statements of national goals. In home economics, it's often obviously looking at the honesty in terms of consumer advertising and awareness of deceit and deception in advertising in terms of consumer education, home economics, and in personal relationships such as family studies. In the personal and social development side, or life skills, or in social emotional learning, the concept of honest and caring relationships is woven throughout those kinds of models. And in physical education, fair play is often used as another reason people learn how to compete honestly and be fair in how they play and compete with others. But to my knowledge, those aspects are rarely studied or reported in any evaluations of student outcomes. And so if we're really looking at the original purpose of schooling, which was to, when the Industrial Revolution occurs in countries, kids are gathered in cities and they need to be taken care of, so the churches and charities and communities start their own school systems, and they're really the socialization of youngsters into a proper life, and also controlling their behaviors is often the very first goal of such schooling. It then becomes more academic and more organized and so on afterwards, but that core function of teaching students to be good people and helping students to become good people is it's still there in schooling, and it's not necessarily evaluated the way we could, and if we're looking at personal and social development. I'm shifting gears here to what the kinds of webinars and concept notes that have been done by our working group and research network, and you can see on the left-hand side there, that column, we've tried to flesh out what we mean by the scope and nature of health and personal and social development education. And so we have webinars and concept notes on those topics, curricula and extended education and so on. And on the right-hand side, we see some of the learning behavioral models that we're investigating and having experts deal with them. All those papers are going to be available at that page at the bottom of the slide. We've built in in the Fresh website a place where people can make comments. So I invite you're going to that page after the session and looking at some of as they appear over the next couple of weeks. You'll be able to have a chance to comment on them in draft form. This is the task of what each of the webinar leaders or in the paper, the concept notes, we're asking people to define that term or that model. We're asking them how it's been used, and I think you've seen that a little bit earlier in the presentation. We're asking them, and this is the hard part, it's going to take probably more than a year to do in each case, to develop a hypothesis of the minimum student learning outputs that are necessary in order to get students to be at a threshold of behavior change when they leave their schooling. Schools cannot be held accountable for behavior change long term. We don't expect we expect students to graduate from school knowing how to read and write, but we don't expect schools to be accountable for the reading habits of adults after school. So we need to think about what is the minimum in each of the topics that we're trying to promote, in each of the general models that we're trying to promote, and indeed in terms of the broader frameworks and approaches that we're trying to promote, what is the minimum kind of student learning outputs that are not only desirable but also achievable. And going back to that notion of there's a limited amount of time available in the classroom and within the school day. And then the last is to obviously look at the readiness of teachers to be able to deliver that. So that's kind of the framework for our task that we've given to these many experts that are contributing their time. And so that's an aspect of your work. I encourage you to go to that page. This slide is looking at the fact-finding survey that we're going to be undertaking as part of this process. We're very pleased to be working with UNICEF and others on this, and so we've got support to be able to do a fact-finding survey of all countries to ask about not only about their instruction but other components in the FRESH framework. And as part of that process, we're going to try to collect many documents from each jurisdiction and be able to post them into the UNESCO database on health education, and to be able to offer that database for researchers and others to be able to analyze and compare. And so we're in the process of inviting folks to join us and to look at how they would like to do different investigations as we move forward. And the last little bit is the Global Network of Deans of Education will be doing a capacity study of what capacities education faculties actually have to be able to fill the needs of the workforce in going forward. And as we all know, there's an impending shortage of qualified and capable qualified teachers that is already upon us, and is also even more acute in areas like health and personal and social development education. So those are the kinds of activities that are underway to be able to help us to be able to describe the status quo. Dan, I've added a couple of slides here to provide more detail to that. Here's the fact-finding survey. If you look at, it's going to be sent to all countries. It's going to be looking at obviously the core components of a school health and development approach. We're asking if the countries have identified some national priorities. We're asking if they are really truly looking at the whole child, or are they looking at a one topic or one aspect of the child, or one, as I used to say, one body part or disease. So is it really a look at the whole child, or is it? And we're also, this is going to be a bit of a learning curve, I think. There are 16 multi-component approaches: healthy schools, safe schools, community schools, inclusive schools. There are 16 such published models or comprehensive approaches available, published only by UN agencies. And then there are over 30 what we call multiple intervention programs on specific issues, be it on nutrition or physical activity or HIV, sexuality education. There's over 30 of those kinds of different topics. And then we're going to ask those other questions. This is coming from the research on implementation. Do they use evidence-based tools to do situation assessments? Do they ensure high quality in their implementation and planning assessment tools? We are going to ask about their participation in global surveys. We're going to ask if they have an explicit strategy to work within or to mainstream within the education system that provides specific benefits to student learning as well as personnel to schools in their work rather than just technical advice. And then we're going to ask also if the country is beginning to use more of a systems-focused strategy where they're looking at joint ministry budgeting or paired assignments of officials across ministries or consultation with middle managers who are often there to protect boundaries and so on. So that's the nature of the fact-finding survey. It's we're in the process of consulting with Fresh Partners about the questions, and we're trying to keep it to a limited number of questions and try to shift as much as possible to the other stage, which is looking at the analysis of curriculum and policy documents. I just wanted to elaborate briefly by showing what we mean about the whole child, and this is from one of the questions in the survey. You can look at the different ways that we try to nurture the whole child, and the first two, A and B, are really the primary concern of educators in a traditional sense of providing access and success to learning, and part B is really to provide a proper scope and sequence to the educational pathways and vocational planning and engagement with their future and so on, providing school life planning processes. But if you look at the rest, there are a number of other functions or aspects of the whole child that also need to be taken care of, and one of them is providing food and other necessities. I was thinking this morning as I was having my breakfast, the experience of my wife, who grew up in rural New Brunswick, and one of the things that their school did was to provide lunches at school, because the kids were coming from farms and didn't have many resources, and so everybody brought a potato to school and they cooked it together, and the teacher threw in a little bit of meat and vegetables, and they had soup every day. And so that's one of the functions of schooling, is to really make sure that the kids' hunger is being addressed. And then going on to the other function, which is the safety of kids. Custody of the kids is very important, and probably job number one for schools rather than academics is to make sure they're safe. And you can see the list that goes on from there. It's a very wide scope of the kinds of things that schools should be addressing as they truly look at the whole child. And then you can see how that is played out in those 16 different models of comprehensive approaches, and I'm not going to list them. You can see that there's The FRESH framework is really focused on the core components, but you have school health and feeding from the World Bank, you have child-friendly schools from UNICEF, you have health-promoting schools from WHO, and the list goes on. And then with the NGO community, you have several community organizations who have published their own kind of models that, again, are being widely used across the world. And many of these models will be, or comprehensive approaches, will be will be used in countries simultaneously. And then the last, here's that list of 20 different multi-intervention programs that address broad social and health issues, and it just shows how much scope we're really dealing with. And so the survey will try to get a sense of how many of those are actually being addressed simultaneously. The policy and curriculum document analysis that we're collecting, we're looking at over a couple of thousand, but probably a couple of thousand documents we hope to store in the UNESCO Clearinghouse, and we're looking at that kind of analysis. Will in terms of health and personal and social development education, we'll be asking whether it's a standalone health program in terms of curriculum structure, or whether it's a health and life skills approach with perhaps a limited number of topics, or what is often used in Europe, which is personal and social health education, or HBSD, which is a more generic approach, whether it's combined with health and phys ed or combined, and so on, because each of those structures will have implications about what can be covered realistically in the time available. Required instructional time will be another kind of thing we'll look at. An important question which I think has been buried is whether or not there is a generic or essential list of student learning outcomes in the area of health and life skills. And again, another question going back to the conversation about self-determination theory, is there an emphasis in the curriculum on student agency or students forming their own action plans? The analysis that we're undertaking will be similar to what was done recently by OECD on phys ed curricula in 16 countries, and also to that Brookings study, which was looked at 21st century skills. The analysis, when we get to it in terms of the project on preventing violent extremism, we'll be looking at, there was a very good analysis done by the European Union on social inclusion and social learning. And so when we get those documents together in a publicly available database, then we'll be able to do other analyses, and that's where we're hoping others will join in to engage, to use their own expertise and their own work to do that kind of analysis and learn more in each and every case. And the last little bit, which is looking at teacher capacity, we have done a paper on workforce development, which was actually a bit of a response to a UN Education Commission initiative on education workforce development, and we have several people in the working group that have done that kind of work, analyzing teacher competencies and have done systematic reviews and have articulated teacher training required for those kinds of concepts. So we'll be trying to take a long-term look and ask, is there a long-term workforce development plan that is really predicting the number of teachers required for health and life skills education or HBSD education? Is there a national strategy or global strategy to be able to recruit and train those teachers through initial teacher education, and to really look at it from a systems point of view? And I'm going to close with a couple of sort of ending thoughts, and I'm going to ask Dan to jump in too. And the two here are both a positive and a negative and a positive. The point number one here is we really can't afford, both in terms of time and money, to use the ad hoc and sporadic and competitive and somewhat confused approach that we've used, at least to my knowledge, since I began to become involved in school health promotion and development in the late 80s, and I think it has not changed. There was a time when there was a focused attention on health and life skills education. The Americans did a very good study that showed that 50 hours of instruction in a health education program had an impact on behavior, and I think that's the last study that was ever done on the amount of time in a core curriculum that is necessary as an infrastructure to be able to deliver all those topics that we're all talking about now. And so we really need to move from an ad hoc and sporadic approach. And then the second point, which is a positive but also a challenge, is the UN goals 4.7, and into that there is a 4.71 and 4.72 targets, which could be a home for a proper look at what we're actually teaching students in 3 different contexts about HBSD. And to date, because of a whole bunch of challenges, it's not a failing, it's a question of capacity and the capacity of countries to be able to collect and look at data, is that there has not been a plan yet to look at what those kinds of how to monitor that. There are plans to look at global citizenship education. There are plans to look at sustainable development. There's an odd little bit about tracking how many students are receiving HIV education, which is, I'm not sure how they're going to, the methodology for that, but we really need to take the opportunity to be able to develop not only the coverage and the content that's being intended, but also to look at what students are learning. And that's a very big challenge. And that is despite the agreement in Korea at the Incheon conference in 2015 that health and life skills education, or health and life skills, are an important part of the overall development of students. And so that's a challenge and also a barrier that we need to overcome. And this is the kind of report that we're hoping will develop by next fall from the FRESH working group. That there will be a real-world method and a core curriculum program focus for HBSD learning. There'll be a global status report with links to existing curriculum programs, that there'll be some basic indicators that can be used to monitor going forward, that there is a incremental and innovative and process or approach to addressing and enabling countries to choose the priorities within the topics and concepts and approaches that they need to choose from. And then there will be a long-term framework that countries can use to be able to look at how to develop their HBSD education workforce, both educators and non-educators, and then finally a global education research network through the credibility of the World Education Research Association on how to define, test, and monitor student learning in this area. So that's kind of where we're hoping our results will lead to, and maybe stop here and ask for questions and comments, and Dan, maybe ask you to comment on the last 2 slides as well. Maybe Dan, if you could do that, and then Caroline and Emily, if there's any thoughts and questions that you have, please jump in.
Yeah, I'm happy to open it up to a broader conversation. I think you've covered the challenges quite adequately, and the other important point to make is that all of this work is not our work. It really is reliant on a community coming together to contribute to it. So where people have interest and energy and expertise, we're really hoping that they will reach out to us as well to engage in accomplishing what we're setting out to do. So we have our emails at the end of the presentation, and we really do want people to feel free to reach out to us and engage with us in this process. But I'll just throw it open to any other questions and comments that people have and want to make.
Yeah, hi. Thanks for this, and sorry we're only basically 2 participants apart from the 2 presenters. This is quite a Hercules task. It seems like huge. I just wanted to take one step back and ask whether you're engaging or taking into account discussions with when I see papers like more kind of from especially the World Bank or economic development agencies, they don't really look at this. They say schooling is good in itself, and then they make links between, years of schooling and the impact that that has on infant or child mortality, family size, uptake of, family planning, especially for women, and also at economics, like, so and so many years of schooling, and then people make more money. They look at those kinds of links, and they basically typically say it doesn't really matter what is taught in schools. The thing is that kids need to go to school. I'm just bringing this up because, that seems like what has been the discussion sort of like in the past, I'd say about 30 years. And it is valid. I mean, I do think that that way of looking at it, very, very broad scope, is valid in the sense that they do come up with data, and they do show that, no matter how bad the school is and no matter what is being taught, there is an impact on the quality of life just by schooling. And anyway, I just wanted to know whether you're taking those studies also into account in the bigger picture. Do I make any sense?
Yeah, absolutely, and I think that's a great point. I'm a little less pessimistic about the idea that whatever gets taught. I think there is a lot of work that educators do across national borders to make sure that there's particular value systems and approaches that are embedded in much of the education system. So there's a lot of, I think, standardization that informally occurs, but absolutely, I think the work that they do. One of the problems I have with the idea of linking what happens in schools to particular economic or behavioral or indicators and outcomes is that we do, as you're saying, I think, minimize the process of education, and we begin to think about it of a individual cause and effect kind of relationship, rather than much more of a communal and cultural value system that is part of what is happening in education, and it is the creation of that community and that value system that then can help facilitate and engage the participants in that, empower them, again, getting back to self-determination theory, to have those positive outcomes. And what gets missed also when you look at those global documents and World Bank and UNESCO and World Health Organization and other kinds of things are what Doug was talking about earlier, where those organizations come in with the idea of how can we leverage change, and particularly how can we leverage change without bringing in new resources. And so they get into this very behavioristic model of, well, the way we leverage change is we create particular policy mechanisms and requirements that are targeted to those particular outcomes that we want to result in. And that behavioral type of approach, there's I think a real solid foundation for pointing out why the system will tend to resist that behavioral approach that limits that autonomy that they have to build the culture that will result in the general wellness of the community. And you begin to get either very short-term change, or you begin to get the system trying to get to the outcomes without engaging in the positive behaviors we want that would actually lead us to those outcomes. And so you get a lot of unintended consequences. So I think the link is important between education and wellness, but the mechanisms that those global organizations see for achieving change tend to be not as helpful because they're very behaviorist in the way that they look at implementing them, and the focus on particular outcomes rather than the process of getting to those outcomes, really pulls us away from the idea of what education can be really about, and sees it much more as a process of cause and effect and program implementation and outcome, rather than community development.
Yeah, and just to jump in, and maybe two parts of Carolyn's comment. The first is the World Bank and others are right, and if you look at what schools do, even as when they talk about the health and life skills of their students, the first job, part A in the slide that's on the screen, is first of all getting kids in school and enabling them to get an education as far as they can, and that's still the primary function of school. First job, that's their function, and then secondly is providing a pathway or several pathways to further academic studies or to vocational planning or to engaging with their future and their future life. And so that's really A and B are what I think Carolyn's the World Bank. Maybe the World Bank is more on A, but those are the two primary aspects of the whole child that will always be there. But part C, as I said earlier, the providing food and other necessities, providing for the safe custody of kids, in situations where there is security issues, that providing for their security, then moving to physical and mental health, some of those health body parts and diseases that we have to be concerned about. The WASH programs, obviously, in G. So all those things are operating at the same time in schools. And so what our challenge is to recognize that those needs are being met through a variety of not competing but compatible, but still overlapping frameworks that people bring into the school systems. And so as we organize and choose one or two or three of those frameworks or those approaches and those many different issues that we want to focus on, we need to recognize that we need to make choices. As the FRESH framework says, we need to focus our resources. And so countries need to be enabled to focus their resources on the issues that matter most to them. And probably in some systems, then states and provinces need to do that, and even school districts and their agencies, and right down to the school level. So it's not just saying that schools need to deal with these 5 or 6 health issues or social issues, but rather enabling folks to make choices that are more realistic and relevant to them. And that's the kind of approach that we need to think about doing, rather than laying on the latest topic of the day or the latest framework of the day. And that's a real challenge to the way we've been doing business in school health and development, because we have all these investments in those frameworks and in those multi-intervention programs or even single interventions that people are funded to do and rewarded by doing. And so we need to think about how they can continue to do that, but they need to do that in a broader and more coherent way. And that's the challenge, I think. And then being Hercules. Now, there's no Hercules, and we've relied on champions enough in school health that because champions eventually get tired or they get promoted, and so I'm not sure what happened to Hercules, but so what we're trying to set up is a process by which people can say, oh yeah, we need to think about these things and choose the things that are more important to us, and then provide resources for them to go to as they think about it. And so countries are able to make their own choices based on their own resources and their own needs. We just need to start that as the point. And that leads me to a kind of a pessimistic but realistic example. In my experience over the last 30 years, there's been 2 countries that have experimented with the idea that schools and local school districts working with their health and social agencies should choose their issues that they think are most important to their children from a health and social perspective that are real barriers to students' learning. England did it and New Zealand did it. and both programs, health promoting schools programs in those two jurisdictions, were eventually stopped, basically by the vested interest in the health system, because they were not dealing with the health issues of the day. And so we need to think about how this paradigm shift can occur, and then allow people to take practical incremental steps down their own self-improvement plans to be able to address it at the different levels. And that's quite a dramatic shift from that's not the self-determination that Dan talks about as systems. And I think that's where we need to go. And then be patient about the amount of time, because it will be a journey without an end. It will be a journey, not a destination. A long answer to your question, but Emily, do you have any thoughts you wanted to share?
First of all, thank you for the presentation. That was both very interesting and raising challenging thoughts. So thank you for that. I'll be very interested to get the presentation as well. My first reaction, as Caroline, was to say this is an enormous task. So it's great to know there's a big group behind it, and hopefully the entire community working on these issues can benefit from it. You know, and perhaps to introduce myself also to Caroline, I'm helping to coordinate an interagency group that with 7 agencies that are willing to work together, first to reposition school health and nutrition in the global, regional, country agendas, and ensure this area of work that has been neglected for many years is put at the right level of attention, but also looking at how to better coordinate and integrate the work, especially at the country level, exactly to avoid all the overlaps Doug you were mentioning. So the work you're doing in that sense will be very useful also to inform our efforts. I think it shows a realization from UN agencies that we cannot continue with so many frameworks and at time competing agendas. But there seems really all that shows that there's really a momentum now with partners at different levels and from different angles re-looking at this issue and trying to prioritize it. So we very much look forward to the outcomes of the work you are conducting.
Thanks, Emily. Caroline or Dan, further comments?
Yeah, I do want to be conscious of time. Where I think this was set up for an hour.
Yeah.
But if you do have time, I did have one more comment.
Sure. This is meant to be a resource for people, and I do say that we have over 80 folks involved in bit by bit conversations. Hopefully, we're creating kind of an ongoing process. But we also are calling for volunteers to jump in on different things that interest them most. And we did that once, and we got 4 or 5 expressions of interest. And I'm confident we'll gather. It'll be like a snowball. I'm Canadian, so I always think of snowball.
Right. Yeah. Well, so my other question was for Dan on this thing about the model of the different domains that will basically motivate or demotivate change, and they were basically all divided into, like, this could be more into self-determination, but it could also go into more kind of a control, less self-determination situation where teachers will actually be demotivated or resist change. And well, I don't know if you can go back to that slide. We have the 3 psychological domains, and then it was a little bit. I think this one, yeah. My comment on that was that it's very much a teacher perspective. So either, the teacher will be empowered and strengthened and so on, or will feel controlled and therefore may resist any kind of those, curriculum changes and so on. And I'm kind of like missing the child's perspective, and also the community, not the teacher community, but the really, the community from which the child stems, which is usually kind of like the group of parents, but can also involve other people from the community. And I just felt like the way you've kind of rolled this out is very much from the teacher perspective. And whether you could talk to that, Dan, briefly.
Yeah, absolutely. And this was just to illustrate one way that this plays out, but for sure it happens in schools at the teacher level. It happens in communities, in families. I think there's a lot of ways to, in many ways, the way we think about behavior as a culture, as a community, at least in North America, is very much along a behaviorist kind of a pattern. If we think about the idea of the way parents implement consequences, and we talk about the role of punishment and reward in children, and controlling their behavior, all of that is very much a behaviorist kind of perspective that then has the implications of limiting the agency of the child. And so we need to shift the way we think, I think, at all levels, into how do we help people make good choices that they make of their own volition. So I can for sure, as a parent, create a way that I will leverage my children to behave in particular ways, because the punishments I will allocate will be severe enough that it will control their behavior, or I can bribe them into other behaviors through a system of rewards. But what really I want to do is help my child really make good choices that will result in positive outcomes in the long term, and make those choices of their own volition. And you see that as children grow and develop and become more rebellious through their teen years and into their early adulthood, because what they're trying to do is exercise that agency, and what they're finding is a school system that is highly extrinsically set up with grades and broken into individual courses, and you have parents who are looking at particular behaviors and allocating punishments for inappropriate behavior. And so there's all kinds of extrinsic controls that then limit their amount of agency. And that's why I think you get a lot of the rebellious behaviors, because we haven't focused on helping children develop the capacity to make positive choices and take positive actions of their own volition. And this in that respect, this is a huge sea change in the way that we think about society operating. But when we get there, when you can work with people on developing positive parenting strategies, when you can conceptualize policy as how do we facilitate change rather than control change, when you think about funding to support activities rather than to specify or create activities, we can begin to shift that dialogue. It's not easy, and when you're within the system, it's much more complex as a teacher to think, or as a parent to think, how can I build the structure that helps my child make an appropriate decision, and how can I allow them to make mistakes that they can then learn from as they grow and develop, versus how can I know what the mistakes are, and how can I prevent them from happening by creating a system of rewards and punishments to guide their behavior. So it's a lot more work to think about it from a self-determination perspective, because you're much more focused on creating a positive environment rather than controlling a specific behavior. But it's much more effective when you can get to that point where people are able to engage in the appropriate behaviors of their own volition. There's a whole lot more to talk about here, looking at schools and grades, and so much of our lives are set up extrinsically to be controlled. It is a very long and challenging task we set for ourselves, but I think when it works really well.
I'm just going to go back to the slide that there's a real interesting discussion to be had applying that to health and life skills education in Europe. Denmark, out of Denmark, there was a model where it really is a student agency model where students are empowered to help improve their environments and their own behaviors by empowering them to doing projects and activities. It's a really kind of quite a different approach to health education than the traditional medical model of providing knowledge and prescribed behaviors. And we're in this series of webinars we're doing from the work group. Our next session is on life skills, where there's been an approach being taken on that in Mozambique, where it's again a student action model rather than a student learning specific behaviors model. And so I think that's part of the application of self-determination theory that we can think about, but there are many others in terms of also the organizational rewards and structures that motivate our behaviors in terms of careers and so on. So it's a really good insight for a tool really for us to think about how we're approaching school health and development generally, and how we're approaching health and personal and social development education specifically. Any further comments? Sorry, go ahead.
Yeah, I want to jump in. That's a great point, Doug, because a lot of those kinds of things we do, and we've noticed they're effective, but we haven't made that link to any kind of underlying theory that helps explain why they're successful. And so, that's the other benefit of self-determination theory is when you look at those programs like you're discussing, it becomes apparent what the mechanism is for that program being successful. And there's lots of practices we engage in as teachers in schools that we've noticed, for example, around classroom management, when students come together to create the rules and the policies and the procedures for how class plays out, to be safe and to give people a space to learn. It's much more effective than when the teacher comes in and mandates what rules are going to be for the class. The self-determination theory component gives us the mechanisms that explains why that is. But frequently we do these actions without realizing why we're doing them or why they're successful. We just know that they are successful. And so the more intentional we can get about understanding why these kinds of autonomous supporting interventions have these positive outcomes, then we can be more intentional about designing future autonomous supporting initiatives that will hopefully also have those positive kind of outcomes. So that's a great point you made in illustrating those types of programs.
Yeah, no, I think there's nothing more practical than a good theory. I'm going to finish up by inviting folks who are going to be reviewing this recording or the slides to take a look at the web page that's there, and Dan's information and my information is also there. Please contact us and take a look at there's a report on the Fresh Working Group activities as of February 2020, and take a look at what we're doing, and if there's a part that you would like to contribute to that relates to your current work, please jump in. And as I said before, it's more a long-term journey than a destination that we're going to achieve specifically in the near future. But thanks everybody for participating, and looking forward to making contact in the future. I'm just going to stop.
Okay, thanks and bye-bye.
Okay, bye-bye.